Preventive checkups and patient staging take place here. As a preventive measure, women starting at age 50 are advised to have a mammogram every 2 years, as the risk of the disease increases from that age. A mammogram is an X-ray examination of the breast, which is supplemented by ultrasound diagnostics in our center. Since an ultrasound does not involve any radiation exposure, it is recommended to be performed every year. If a woman has already had surgery at a breast center, she needs to undergo regular follow-up diagnostic, mammography, and ultrasound examination, but in this case, they need to be performed more frequently. A mammogram once a year, and an ultrasound twice a year, that is, every 6 months. In case there are any uncertainties in the diagnosis, an MRI is additionally performed. However, ultrasound continues to be one of the simplest and most effective diagnostic methods for preventive purposes. Because here, for example, in the case of young women, there is no need to expose them to radiation. Since the mammography procedure involves radiation exposure, it should not be done too often without specific indications. Breast cancer is actually the most common type of malignant disease found among women. For instance, in Germany, every 8th or 9th woman faces this disease. If there is a hereditary predisposition, meaning that when several family members, either on the paternal or maternal side, have already faced breast or ovarian cancer in the past, it is recommended to conduct a genetic study to clarify how high the probability is for a healthy woman with such a family history to develop breast cancer. And at her request, a genetic test can be performed to determine whether or not she carries this specific gene, and then decide how to proceed further. Either choose to undergo specialized preventive screenings, or perhaps even it might make sense to undergo a preventive surgery. And of course, it's extremely important, as you might imagine, when a woman or a man has children to whom they could pass this gene on. If this genetic marker is present and surgery is not desired, regular specialized preventive measures can be recommended for the patient. Specifically, this means that we start working 5 years before the potential onset of the disease. For example, if I had this gene and my mother had developed breast cancer at 40 years old, I should have started undergoing important preventive screenings from the age of 35, as recommended. That is, having an ultrasound every 6 months, and once a year having a mammogram or an MRI.